So making a presentation on stigma and discrimination, key obstacles for Nigerian adolescent girls and young women seeking HIV and STI care. Stigma, stigma, stigma. We've heard so much about it over the couple of years, even in this the workshop. But we can't get over it until we get to a level of zero discrimination. HIV-related stigma can be described as the violation of people either living with HIV or associated with HIV. Discrimination follows stigma and is the unfair and unjust treatment of an individual based on his or her HIV or the perceived HIV status. Stigma and discrimination breach fundamental human rights. It affects the rights of the individuals and can occur at a number of different levels, including societal, institutional, and the political space. Nigeria has a population of about 270 million individuals, with the youth accounting for 70% of the population. HYW in Nigeria continue to face significant challenges in accessing HIV and STI services, and which is mostly due to stigma and discrimination, which hinder their healthcare seeking behaviors. HIV and STI, the prevalence among this population is still high, despite the measures to increase access to healthcare for this group. The Nigerian HIV and AIDS Indicator and Impact Survey 2018 shows that approximately we have 180,000 people, young people living with HIV in Nigeria, and the HIV prevalence among 15 to 24 years girls is 0.8, according to the NICE 2018. Well, however, the prevalence was highest among females, 20 to 24 at 1.3%. For the study was conducted in 2021 in 6 states across the 6 geopolitical zones of Nigeria. We have the North Central, the Northeast, the Northwest, the South-South, Southeast, and Southwest. And each of the states was chosen from each of the geopolitical zone. The states were selected based on the existing HYW interventions ongoing and the coverage with high HIV prevalence. We used a cross-sectional descriptive method, which used both quantitative and qualitative data collection methods. For the quantitative data, we used key informant interviews, where the service providers at these service delivery points were interviewed. And for the quantitative aspect, we used the client exit interviews, where clients receiving the services at these service delivery points were interviewed using structured questionnaires. We have 2,520 adolescent girls and young women which were interviewed using the client's exit interview. For the findings, we found out that 70.9% of the group reported stigma and discrimination as the major barrier to them accessing HIV and STI care. 12.1 reported fear of harassment. 6.2% said pre-existing cultural and religious belief prevented them from accessing these essential services. 3% said the negative behaviors of the service providers also hindered them from accessing these services. Intimate partner abuse was 1.6% as reported by the respondents. This is just a graph showing stigma and discrimination at 17.9, which is one of the major barriers to AJIW seeking HIV and STI care. In conclusion, the study shows that you have several significant barriers that prevent AJIW from accessing HIV and STI care. Stigma and discrimination emerge as a major obstacle, affecting nearly 1/5 of this group. Can also say that improving HIV and STI care access for this group means we need to address the societal, cultural, and institutional challenges that this group faces in seeking care. So as a way of addressing the issue of stigma and discrimination, we need to enhance community education, sensitization among the community members on stigma and discrimination, and also provide the services for this group where they feel most at home. They might not feel comfortable at the health facility, so we can also bring the services closer to them at where they feel most at home. We can also use the peer-to-peer method, where a young girl who has faced challenges and overcame it speak with the fellow young person, and then this will help. Also, engagement of the community leaders, religious leaders, to promote acceptance and reduce stigma. Also, we need to review the age of the consent so as to improve access to health care for those who are younger than the current age of the consent. The training and training of healthcare workers and service providers to help them be able to facilitate the services to these younger generations. Then introducing quality comprehensive sexuality education in schools for all adolescents. So that was all for me. Thank you so much.